everybody. So I would like to go into the practical use case of selecting clinical sites and to see how it can fit your specific study needs, but also see how we can work on how we can search also for key opinion leaders. So what is the agenda of today? I would like to first set briefly the scope of the meeting. What we'll try to do here, what are the data sources that we specifically are working with, and then give you a demo, and then we can go in a Q&A. So first, giving a little bit more information about the scope of the meeting, what we have and what the current, so just to quickly check, is everybody able to see the slides and can hear me well? If there is any question on that, please raise your hand. Okay. So, but let's continue. So what we will do and what I will touch today is giving you a brief overview of a public DISQOVER platform, which you can retrieve on www.discover.com. It has more than 140 different public data sources, and a few important ones which are important for this the webinar today are clinicaltrials.gov, UDRA-CT, and also the World Health Organization Clinical Trial Registry, but also support of many other different data sources. But what I would like to show you is the addition of some specific data sets which are retrieved from the US government, which are touching or which are containing information about the US healthcare professionals and US healthcare providers. So that's data which is residing on a demo DISQOVER platform, and I will show you how we integrated that together. This is a test environment. What I also would like to get from this webinar is there is feedback from your side about how to continue, how to extend to other countries. We are very welcome to receive your feedback on that. So the ambition is that we would like to further extend this to other countries and also fully integrate this with the existing available public data sources. But you will see that with the demo setup, we can also get to an end result. So what are the data sources which are under attention today? The majority or the major source is the National Provider Identifier list, also provided by the National Plan and Provider Enumeration System. I added a screenshot where you can download or where you can find the data, and we further supplemented this information with the National Uniform Claim Committee data, which is the healthcare provider taxonomy. This healthcare provider taxonomy can be used to further specify what are the medical specialties or what are the type of providers that are available if you do a search. So this will further allow you, this taxonomy, to classify every person that we retrieve according to their medical specialty. Okay, let's switch to the demo. So I will stop the presentation here and switch to my screen. So this is the demo environment that we have, but I also would like to give a brief introduction about our public data source, our public data sources. So what I would like to do here is, this is a demonstration of a demo system, and you see here the default data types that we offer. So what this means is you have different data sources. Different data source provides different pieces of information and are also touching different entities of information, different concepts. For example, publications, clinical trials, diseases, but also like drugs, genes, proteins, etc. All of these concepts are clustered together in classes, and these are the circles that you can see. And what we also have here in this demo environment is that we have some, what we call here, locally defined data types or canonical types, like medical specialty or medical professional and an organization. I will switch now to a brief overview of all the data sources we have. So this, what you see here, is a combination of the local data we are running on this local test server, and I can show you that we have these two sources. It's a subset of the two sources. And then we have an extensive list of data sources which are part of the public offering of our public system. So if you click on a certain data source, you will see an explanation. I can see here, for example, ClinVar, and you can see that this is giving you some information about what is ClinVar about, what are the data types which are provided by ClinVar, etc. And you can do this for every source. What is important here is, because of the nature of what we do, this integration of data, that we can also show you how the big graph of data is constructed, so that every data type has its own place in a bigger graph, but that it's also fed by the different data sources. So giving you a default example like PubMed, you will see that PubMed is providing that amount of data, or is providing for these data types the different information. I can show you, if I hover over, what it means. So you see here a specific data type. I can set this to automatic, the view, and then you see a legend, what everything means. We have this for PubMed, but I can also show you that for example, the data source we are adding here. So this is only a small part. And if I'm also adding the second data source, you will see that this is covering more about the same thing. What is now automatic, what is now important is that we are extending, for example, this data, or linking this data to clinicaltrials.gov related data. And here you see another set of the graph. So that's the aim of what we do. You have specific data types where you can navigate, where you can search on, and then we try to extend that with other sources. This is the theoretical background of how everything works. This is not so important. This is the majority. The major thing is how can you search the different systems. So this is the default dashboard that you get to start to search. And what it means is that if I'm typing here a certain search term, that we're able to show you what are the occurrences of that search term in the different data types. So I will start with an example, mammary neoplasms. What it means is that what is happening now is that we are looking for the term mammary neoplasms, so the two words together, where they occur in the different data types we have. You see two types of highlighting here, with a white background and with a green background. With a white background means that we find hits which are related to just finding the search term, the string, somewhere in the text or in the content of the data. If you have a green background, you have two types of hits. You also see two numbers. This means that mammary neoplasms, the term on itself, matches perfectly with one of the diseases, or with two of the diseases, and one of the phenotypes that we have in our system. That means that it's the official label, a synonym term, an abbreviation. All of these terms are showing a semantic hit. But in addition, we also have 67 times another hit, just a hit somewhere in the text, potentially that in the description or in other types of information, the term mammary neoplasms is mentioned. Now I would like to show you how we can expand our search. So if I click here on the plus sign, we open an additional pop-out window, and you see here different synonym terms for mammary neoplasms. That means that this allows me to expand my search with all these synonyms. I will quickly go back and just show you the number of clinical trials we find. So this is approximately 7,400 clinical trials that we find. If I'm extending the search with these additional terms, we find more than 1,000 additional clinical trials. So it's a more complete search, it's a more complete overview, and also you see some new data types highlighting, where the term mammary neoplasms was not used with one of the synonym terms. What I now would like to do is show you, can we find specific people, specific investigators, and as key opinion leaders and facilities where these clinical trials are conducted. So I'm clicking on clinical studies, and I get an overview, a dashboard of all the clinical studies which are matching the terms that I'm looking for. So this is a dashboard with some filtering terms, filtering capabilities, and this is the list of results of clinical trials. What is important here is that I can add some filtering steps, and I'm specifically interested in US clinical trials. and we are working here with a subset, so I focused on the Boston region. So I'm going into the United States, I'm going to Massachusetts, and I take the clinical trials which are related to Boston. So this gives me an overview of how many recruiting, non-recruiting, and different stages there are. I get an overview of the different types of classifications. I get an overview of the study phases. I can zoom in on all of these to get a more detailed overview. But what is very important here is if I click on a certain study, that I can see the details of this study, and that I can also show you that the information of these clinical studies is retrieved from different sources. So this is a single clinical study, but it's mentioned twice in two registries, clinicaltrials.gov, but also the WHO Clinical Trial Registry Platform, which is an aggregator of clinical trial data. So what it gives is the possibility to distinguish what every source is contributing, but in addition, I can follow semantic links to other data types. For example, I could go to the organizations which are associated to this specific clinical study or to other related data. What interests me more is that I would like to get an overview of these clinical studies which are related to mammary neoplasms. Who are the medical professionals that are involved in these clinical studies? So when I click on medical professional, I get a list of all people that we retrieved from the national provider identification list, and it's still not complete, like I said, it's a subset, but it gives you at least a hint of the capabilities we have to filter. So this is a list of people involved in the clinical trials in the Boston area. You see their specialty in certain cases and their affiliated organization, and I can do some filterings now. For example, I'm interested in people in, let's say, medicinal oncology, and I would like to see if I find certain names, how many people are in this list in medical oncology or in hemato-oncology. But I can also specify a certain organization. Let's take Dana-Farber Cancer Institute. So I'm narrowing down the list from 80 results to 10 results. And what I get is these are all the people from Dana-Farber who are currently related to the clinical trials I was looking at. So you get, if I click on a certain person, the details of that person, contact details, telephone number if necessary, but also information about other related items. For example, literature-related information or other clinical studies which are related to that person. So I can follow, for example, the literature of this single person and show, if I'm zooming out to another screen, another dashboard, the publications related to that person. This is very valuable to investigate if that person is a true key opinion leader, if the person is really specialized in the domain you're looking for. I can go back in my search, so you see here the different tabs which are open. So I go one tab back to go back to that single person, and I could do another use case. For example, this is the list of 10 people from Dana-Farber, but I would like to get an overview. These are medical oncologists and hemato-oncologists. I would like to get an overview of all medical oncologists and hemato-oncologists of Dana-Farber. How can I do that? I'm just clicking here on this link to link out to the concept Dana-Farber Cancer Institute, and I get here some information about Dana-Farber Cancer Institute itself. But again, I see here a link to more than 200 medical professionals that we have currently captured from the institute, and I'm going back to the people. So I'm pivoting around the institution, the hospital, and I get a larger list of researchers. What is now interesting is that I can do the same search, the same filtering to say, okay, go into my tree of medical specialties, click on medical oncology and hemato-oncology, and I get now a list of 60 people instead of the 10 people I had before, because this is the extended list. This is the people who are also not directly involved in the clinical trials. So these are, with a high degree of certainty, direct colleagues of the people you were initially looking at. Again, for every individual, you can double check if that individual is, for example, has certain publications, is already related to clinical trials, yes or no, and you have contact details. Okay, so these are the main types of searches you can do. Another type of search could be, so this is one specific search, another type of search could be that you start not with a clinical trial, but with people or with the medical specialties. The last thing I would like to show, because we were doing a number of clicks here, a number of dashboards, is if I click on this symbol, linking symbol, that you will see what are the different searches we have conducted here. So you can check on the information here available about every individual dashboard that we created. So let me start with another search. For example, I would like to look for medical professionals in a certain domain. So what is now possible is that I have the list of everyone, and we only had 30,000 people here. So it's a much more extended list for the whole United States. It's just for showcasing the capabilities here. But what is now very powerful is that I can, for example, say, okay, show me everybody who is associated with Brigham and Women's Hospital in Boston. So I'm filtering down the list. You see the people here involved. And in addition, you can also see an overview of the specific medical specializations. So you get a nice statistic about who are the people involved or who are the people in certain domains. Let's take, for example, everybody in internal medicine, and you could be able to say, okay, restrict my dashboard. So focus only on the 130 people that are active in internal medicine. Take a look, but also, for example, create another visualization. For example, I would like to see if I can take the medical specialization in a pie chart, for example. And you can quickly make an overview. What are the biggest types of internal medicine people? And you see here an representation of pulmonary disease, so lung specialists, infectious diseases, internal medicine people, etc. So this is a very easy extension. This is showing that a dashboard can be adopted, can be extended. You can also link to multiple dashboards. You can go back in your searches. Let's say that I forgot something to do, and I would like to go back to my overview of clinical studies that I was initially looking at. This is my focus point of 560 studies, and I can even create, if I restrict my dashboard to the 560, I can even go to related dashboards. For example, a timeline view to see how are these 500 clinical studies conducted over time. This is color-coded, so you see here in green the recruiting clinical studies. This is today. I can zoom in this and say, okay, I would like to see if there is a subset in a certain phase of clinical trials conducted. And all of these is clickable, is adjustable. You can make other filterings, not on phase, but for example on location, etc. These are possibilities we also offer.